everyone, my name is Sheila and I'm the Director of Nursing for Sunlight Services and Hazel Senior Living. First of all, welcome. We're excited to have you be a part of our team. Today we will be going over a lot of different information, including an introduction to home care and the Bill of Rights, caring for our residents, emergency preparedness, and so much more. So let's get started. Clients have many options for housing and service needs, including nursing homes, independent senior housing, assisted living, and home health care. In Minnesota, services are provided through a home care license, and there are two levels of home care licenses in Minnesota, basic and comprehensive. The two different titles describe the different levels of services that can be provided under each license. Basic means providing basic tasks, including assisting with dressing, grooming, oral cares, toileting and bathing, reminding residents to take their medications, preparing meals for them, and assisting with household chores. The comprehensive license means that more services can be provided. It includes everything provided under the basic license, plus performing delegated tasks under the supervision of a nurse, medication administration, hands-on assistance with transfers and mobility, assisting residents with feeding, providing services of advanced level practitioners such as having nurses, therapy, social workers, and LPNs. Our facility is a comprehensive home care license. The Minnesota Department of Health monitors compliance by completing routine surveys. Survey visits are unannounced and no notice is given. So we always have to be prepared because it can happen at any time. They come at least once every 3 years, and the purpose of these visits is to come in and assess the overall quality of services and care that we provide, and ensuring that we are complying with all the laws and regulations of our license. During their survey visits, usually a nurse from the Minnesota Department of Health will come and complete these visits. They will review client charts, employee files, all the training practices and policies, procedures that we have. They will observe client care. They may interview clients, family members, and employees as well. Be aware that during the survey process, you may be asked to participate, which is normal. When the Minnesota Department of Health arrives, make sure to ask them for a business card. You will then want to call the operations manager and the nurse to let them know that the surveyors are here. Continue on caring for the residents like you normally would, and always remember infection control, so hand washing and all that fun stuff. In the event that the survey finds a problem, the company will have a chance to correct the issue, and a follow-up visit will happen to recheck the issue to make sure we are compliant. Fines can also be enforced depending on what the problem is. Every staff is responsible for ensuring the company is compliant, and it is not solely the role of management. So what do we expect from you? We expect you to provide good care and services to our clients, maintain good communication and documentation, follow policies and procedures of the company, and there will also be ongoing required training and evaluations that will include competency evaluations and skill demonstrations with the nurse. Again, compliance is a team effort, so if you witness something that just doesn't feel right, report it to your supervisor. One of the requirements of a home care agency is to use a service plan, which is like a contract to perform services for a client. The service plan further outlines the frequency of service, fees for the service, and which staff will be providing the service. There's also a schedule and methods of monitoring the client and conducting assessments, the frequency of supervision and who is providing supervision. It also outlines a contingency plan, and if there are any changes in the service plan must be updated. Healthcare directives and the PALST. So advanced care directives in Minnesota are called healthcare directives. This is a document created by or with the individual that outlines their general wishes for medical treatment and end-of-life care. It may include their code status, including DNR or DNI, which means do not resuscitate or do not intubate. Other use of life-sustaining equipment may also be addressed. It may also identify who will make healthcare decisions for the client in an event where they are unable to speak for themselves. These are legal documents, and it must be signed and dated by the client and witnessed by 2 other people. A copy is kept in the client's record if they have one. And then the PULSE is a physician order that gives clients more control over end-of-life care. It specifies what kind of treatment a client would want towards the end of life and ensures their wishes are honored. A copy of the PULSE is also kept in the client's records. And then the healthcare directive and PULSE complement one another, but a PULSE provides more details, including whether they want IV antibiotics, tube feedings, etc. The Vulnerable Adult Act is a Minnesota law that protects adults from maltreatment, including abuse, neglect, exploitation, or any unexplained injuries. A vulnerable adult is anyone 18 years of age or older receiving services from licensed providers. All employers are mandated reporters, so if you witness anything that may be maltreatment, you must report it immediately, even if you're unsure if it is reportable or not. Some examples of maltreatment include abuse, physical, emotionally, or sexually, including hitting, slapping, kicking, pinching or biting, name-calling, harassment, humiliation, fondling, or any sexual contact. Some signs of abuse may include bruise, burns, cuts and scars, multiple or repeated injuries, any broken bones, frequent trips to the ER, any unusual anxiety or agitation from the resident, or mood changes. Sometimes it can also be aggressive behavior towards clients. This is another example of maltreatment, including verbal aggression, threats, insults, name-calling, humiliation, or derogatory gestures, which is things like giving the middle finger. Another example of maltreatment is neglect, which is the failure to provide the necessary care and service for the residents, such as food, clothing, shelter, or medical care. And then there's also exploitation, which is the wrongful taking of any property or money from the resident. For example, a family who is in charge of the client's money uses their funds to purchase a car for themselves without the client's permission, or transferring funds from the client's account into their own account. So what do you do if you suspect maltreatment? You want to contact your supervisor immediately. An oral report is required within 24 hours of the occurrence, and there's no form of retaliation. The supervisor will then file a report. Otherwise, you may call the Minnesota Adult Abuse Reporting Center directly to file the report. After the report is filed, the lead agency does an investigation, and authorities may get involved, including law enforcement, adult protection, and the Minnesota Department of Health. A final report will be sent to the person reporting. So the Home Care Bill of Rights brings power and control back to those who receive cares and services. It's a living guide that directs how we treat the clients that we serve. It honors their basic choice, beliefs, and wishes. There are 23 rights, and any violation of the rights are subject to fines and license actions. The document must be given to the client and or the responsible party before we can provide services. Again, they have the right to receive written information about their rights before receiving cares and services. They also have the right to receive cares and services according to a suitable plan that addresses their current needs. They have the right to be informed of the frequency of services, choices available, and consequences for refusing services. They also have the right to be told in advance of any changes and be an active part in decision making. They have the right to refuse cares and treatments. Although it's always best to encourage, they do have the right to say no. They have the right to know their limits of service provided. For example, if a service cannot be provided, the client has the right to know in advance. They have the right to be told in advance of any charges for services, payment options, and methods. No other services available and other providers as well. They have the right to choose freely among available providers, change services, and look at different options. And they also have the right for personal, financial, and medical information to be kept private. Additionally, they have the right to have access to records, be served by properly trained and competent individuals, be treated with courtesy and respect, be free from abuse, neglect, or any maltreatment. They also have the right to have a reason for termination of services and advance notice of termination. If there are any changes in provider services, they have the right to be assisted in coordination of care with their new provider. They have the right to file a complaint, know who to contact to file the complaint. They have the right to know the address of the state or county agency for any assistance. And if a complaint or concern is raised about a right violation, there's no retaliation against that. And they also have the right to place a monitoring device in their personal space in compliance with state requirements. So HIPAA is a federal law that protects the privacy and security of protected health information. Clients trust that providers use individual information for providing treatment and receiving payments only, so it's very important to protect their health information. All healthcare personnel must comply with HIPAA. This applies when you're at work and during personal time. You must not disclose any patient information outside of work. HIPAA rules ensures that we comply with the law and maintain our residents' trust. Protected health information is any information received, created, or maintained by the healthcare provider that can identify the individual client. It could be the past, present, or future health conditions of individual, including healthcare services received or payments for those services as well. Examples include names, addresses, telephone numbers, any dates like their birth dates or dates of treatment, social security numbers, health plan ID, email, their health history, treatment information, insurance information, and it could even be photographs that identify the individual. We want to ensure that only people who are authorized to use or disclose PHI have access to it, and we want to use the minimum necessary information to achieve the intended purpose. Appropriate uses of PHI includes using it to deliver care treatments, facilitating payments for health services, teaching and training, and in some cases conducting research. Any other uses or disclosure requires the client's authorization. Disclosure without consent is allowed only in limited situations for health, safety, or legal purposes, suspected or proven abuse or neglect, outbreak of an infectious disease, civil or criminal court proceeding. You never want to disclose information for these limited exceptions purposes without talking to your supervisor first. It may be appropriate to discuss PHI with family members involved in the client's care if they are listed under the patient's emergency contact list. If you're unsure if you can disclose the information, contact your supervisor. So some do's and don'ts. Don't leave any written health information where it can be seen or taken by other people. Don't leave any voice messages that contain health information. Don't share information with people that are outside of work. And don't share passwords. Don't post anything on social media sites that may identify the residents. And don't take any photos of the clients. If you are going to be talking about residents amongst your coworkers, talk softly about them. Don't talk to residents about their health information in public areas. Go somewhere private. You want to ensure that all client records are stored in a locked area when you're not using it. If you're not going to be by your computer, make sure you log off before walking away. And then make sure you know your employer's policies regarding email use. We take HIPAA very seriously, and any non-compliance with HIPAA can result in discipline per policy or termination. Organizations may also be fined for HIPAA violation. If you suspect any breaches of PHI, you must inform the supervisor immediately. The employer will conduct an investigation of the suspected breach and notify any individuals affected. They will also log any breach into the facility's privacy records and take actions to protect against future breaches. Any failure to report a breach may be subject to discipline. When a breach occurs that affects a large number of clients, such as a stolen, unencrypted laptop, the federal government and media must be notified. Failure to do so will result in large fines and penalty. Okay, so we'll go through a few examples of PHI breach scenarios. We'll discuss how HIPAA rules applies to it, how to prevent the breach from happening, and what to do if the breach happens. In scenario number 1, an employee is documenting on client number 1 while a family member of client number 2 approaches the employee. The family member of client number 2 sees the chart of client number 1. So how is that a breach of health information? The family member saw health information about another client. And how do we prevent that from happening? When you see a family member approaching, you can close the open records or lock the computer screen. And then what do we do if a breach occurs? We can report it to the supervisor if it is more than just a fleeting glance of the records. The supervisor may need to retrain the staff to avoid similar situations. So in scenario number 2, an employee shares PHI about a client to a friend or family member outside of the organization. This may have occurred when the employee was telling a story about their difficult day at work and accidentally used the patient's name or other identifying information. Well, first of all, you don't want to ever identify a client by their name. Don't want to describe their physical description or any description about their health status. Even if you don't state the patient's name, someone else who hears your conversation may be able to determine who you're talking about. And this applies to conversations with coworkers at work and outside of work. And so what are some ways that we can prevent this from happening? We don't want to share any unnecessary protected health information. We only want to talk about residents for legitimate work purposes, and another way to prevent this from happening is speak quietly and respectfully. Again, if the breach occurs, notify the supervisor, and the supervisor may have to report it to the client if needed. In scenario number 3, an employee takes a photograph of a client on their personal cell phone. It's never appropriate to take a picture of the client using your personal cell phone, so that's the breach. What can we do to prevent it? Again, no unauthorized photos. Only limited situations such as wound care documentation, maybe take photos of the residents. And then any personal cell phone use or camera is inappropriate. No posting pictures on social media sites. And if the breach happens, again, notify your supervisor immediately. As we age, there are many changes that we go through physically and mentally. We want to recognize each client's abilities rather than their deficiencies, and we want to treat each resident with respect and dignity. It's important to understand their history, lifestyle preferences, and social history, including their friendships and any community involvement. Additionally, we want to promote their independence because it enhances their self-esteem. They always want to do things for themselves. That's how it's always been. And you never want to do more for our clients than what they can do for themselves, even if it saves time. As we age, the skin changes. It becomes less elastic, there's wrinkles, and it becomes loose. You're more likely to bruise and have skin tears because the skin is a lot thinner. There's less subcutaneous fat, which affects your body's ability to control temperature. There's less moisture in the skin, so the skin is more dry. There's also less oil and sweat produced. The fingers and toenails also become thicker as we age. With skin changes, we want to make sure to check the client's skin condition and report any changes to the nurse. Report any excessive warmth, swelling, redness, bruising, or skin tears to the nurse. And then when you're bathing, make sure that you're inspecting the skin. It's not necessary to bathe every day. After bathing, apply lotion and never pull a client because their skin is so fragile. And we want to make sure we're using proper lifting and transferring techniques. Our ability to see and hear may also diminish as we age. Visual acuity declines. Cataracts and glaucoma may further affect our eyesight, and our perceptual vision changes as well. To help vision changes, we want to make sure that the environment has good lighting, use contrasting colors, use large letters or fonts for prints, and we want to ensure that the residents who wear glasses actually wear them and help them clean their glasses as well. If there are any sudden vision loss, make sure you report that to the nurse. And then in regards to hearing changes, different sounds are harder to distinguish and consonants are harder to hear than vowels as we age. What we can do to better assist our residents with hearing loss, we can speak slowly and clearly, use simple statements, get down to their level, and make eye contact. Some residents read lips, and so it helps to be at eye level with them. Reduce any background noise and make sure that the hearing aids are clean and working properly. You may also have to help them replace their hearing aid batteries as well. As we age, our taste buds gradually lose their effectiveness, which may affect our appetite. Some elderly prefer sweets because they still taste it. The ability to taste is decreased as it's directly related to our sense of smell. Some things that we can do is to make sure that their dentures are working properly, check their mouth for any sores that may prevent them from having a good appetite, report any loss of appetite to the nurse, and we want to be sure that the food is presented in an attractive manner that will enhance their appetite as well. Make sure that the food is easy to eat, cut foods into smaller pieces for residents that need help with that. And then we want to make sure that the temperature of the food is at the right level. Hot food should be warm, cold food should be cold. As we age, there's a loss of calcium in the bones, leading to deterioration of the joint. Joints break down and become more stiff, making movement more difficult as we age. Muscles lose their elasticity, total mass, and so then the muscle shrinks and reduces our strength. So what we want to do is allow the client to change position slowly, encourage exercise, walking. If they can't get out of their wheelchair, make sure that they're doing arm or leg exercises. And we want to reduce any falls because if they fall, they're more likely to get fractures. So make sure that they're using their assistive devices. And then in regards to the nervous system, there's a decrease in blood flow to the brain, which results in slower brain function. There's also a decrease in the number of neurons, which leads to slower processing time. So what you would want to do is allow them more time to respond, don't rush them. The size of the heart increases with age, blood vessels thicken and becomes less elastic, and so it may be more difficult for the heart to pump, and then it affects their circulation and the function of the heart. Since there's less cardiac output, it takes longer for blood to circulate. And then in regards to the respiratory system, the lung tissues become more rigid, so breathing may be more shallow. Lung capacity decreases as well as we age, which makes it harder for breathing. and there's an increased risk of developing pneumonia. We want to encourage exercise and assist with ambulation, encourage rest periods as well. Although we may encourage smoking cessation, keep in mind that there's not too much that we can do to get them to stop smoking, especially at that age. There's a loss of tone in bladder muscles as we age, which makes it harder to control the bladder, resulting in frequent urination and incontinence. There may also be difficulty getting urine out for some as well. Additionally, as we age, there's an increased risk of urinary tract infections, and to prevent UTIs, we want to encourage fluids, make sure that they're maintaining personal hygiene, wiping from front to back, and perform scheduled toileting. If there are any signs of UTIs, such as burning upon urination, bloody or cloudy urine, chills, fever, nausea or vomiting, or behavior changes, report it to the nurse. In regards to the GI system, it may be more difficult to chew and digest food as we age. There is stomach muscle loss, which leads to issues with diarrhea and constipation. And so we want to make sure that the residents are receiving proper nutrition and drinking plenty of water. For constipation, we can encourage foods high in fiber. There are many myths with aging, such as personality changes with age. As people get older, they become more rigid and resistant to change. Some people think that as you get older, you just become more forgetful, and that depression is normal for people that are old. And then there's also a myth that older people have no interest in intimacy and sex. However, personality does not change with age. In regards to resistance to change, some do, some don't. It depends on their natural behavior and confidence in trying new things. Memory loss is not a normal part of aging, and depression is treatable. And sexual desire does not change with age. Observing, reporting, and documenting client status. So the state requires that all services provided or not provided be documented and saved. The Department of Health will survey or audit a facility to ensure documentations are satisfactory and in compliance with the state law. And so, and also records may be confiscated and used as evidence in court. So it's very, very important that we are documenting everything that we are doing, such as any changes in clients' conditions and any cares that we provide. We also want to document any cares or services that the client refused as well. This also gives us an ongoing picture of changes in the client's conditions and cares received. These are all legal documents, and if something wasn't charted or documented, that means it was not done. So it's very, very important that you document everything. So what do we document? We want to document any cares and services provided to the client, any vital signs, blood sugar checks, bowel movements, document any medications given, not given, and refused with a reason why it was not given. We want to document any medications that were sent out of the facility and any changes in patient behavior or condition. When we're charting, we want to make sure that we're charting under the correct resident. Although most of our charting is electronically, sometimes you might be required to do some paper charting, and so if you do, make sure that you write legibly and use black ink pen. Avoid any errors in grammar and spelling when you do your charting and documentation. And we want to chart the event or care at the time that is provided. Don't wait until the very end of your shift to chart everything. And then document enough to tell the whole story. A satisfactory documentation is chronological, and so you want to write in the order of how the event occurred from the oldest to present to get a clear picture of what occurred first. You also want to make sure that it's complete, so make clear sentences and right to the point. Documentations should also be concise. Use simple, precise words, and they should also be accurate. Document what you see, hear, feel, measure, or count, and then be descriptive. Be descriptive enough, provide enough details for someone to understand the whole story and get the picture. And make sure all documentation is factual. It's not what you think or assume. It's things that actually happened. So some do's and don'ts of the charting. Don't alter a client's record because it's a criminal offense, such as adding information at a later date without indicating that you did so, or dating the entry so that it appears to have been written at an earlier time. You also don't want to add any inaccurate information, and absolutely don't destroy any records. Additionally, you don't want to chart a symptom without reporting it to the nurse. For example, resident complained of pain. You want to report to the nurse so she can document what she did about it. And then don't use vague terms, be specific. For example, a large amount of drainage on the bed. How much is a large amount? What kind of drainage was it? Was there a color, any odor? You want to state any of the severity, in pain, where was the pain, when did the pain occur? And then you also don't want to chart ahead of time, because what if the resident refuses? Then you have to go back and say that you didn't chart it, you didn't perform the task. We also want to avoid any shorthand or abbreviations that aren't widely accepted, and don't cite your name under a task unless you actually performed it. We also don't want to chart any staff problems or conflicts or conversations in the resident's chart. Don't white out or erase anything that you charted. And then we want to avoid words that suggest that client was not safe, such as words like by mistake, accidentally, or confusing. And then we also don't want to name a second resident in the charting. For example, you're charting under Miss Jones. You don't want to include Mr. Brown in the documentation as well. Alright, so which is an example of good charting? I will let you pause the video and read through these and select which one you think is the best example of charting. Alright, and the answer is E. The client had one medium-sized brown, formed, and soft bowel movement. This is an example of good charting because you're specific. There was one bowel movement, it was a medium-sized, it was the color brown, the consistency is formed and soft. Okay, the next question. On your way home from work, you realize you forgot to document something. What should you do? Go ahead and read through each answer and select the best one. A is incorrect because you don't want anybody else to document something that they did not do. B is incorrect because you don't want to leave out a hole in the documentation because was it done or not? And then C is incorrect because you don't want to go back and make any brief notes in anything that you already documented. D is the correct answer. You can always document things at a later time and note late entry along with the date and time that you were writing. That's acceptable. Alright, so for personal cares, each client has an individualized care plan that provides directions on how to care for the client based on their assessment at admissions and an ongoing basis. We want to provide person-centered care. We want to honor the client's choices, rights, and decisions. However, if their choice causes harm to themselves, then we would want to notify the nurse because we want to keep them safe. We want to focus on the individual and involve those in their care with decision making and offer choices. We also want to ensure privacy and communicate with them. Knock on their door, introduce yourself, explain what you're doing, and then use their preferred name. We also want to encourage independence and understand their abilities. In regards to grooming, when we're dressing the resident, allow them to do what they can for themselves. If they have a weak side from a stroke, we want to dress the weak side first, offer clothing choice. Oral care is expected in the morning and at bedtime. Help them as needed. It's important to brush their teeth to prevent any oral infections. And then you would want to report any bleeding, tenderness in the mouth, or new cracks in the teeth to the nurse. When providing denture care, we want to place any dentures in the denture cup after brushing it in the evening if the client does not want to wear them to bed. Cleaning the dentures will help promote, their mouth will feel fresh, promotes healthy gum. And you want to report any redness to the gums or any damage or lost dentures. Be very careful with dentures because they're very expensive. When you're cleaning the tables, make sure that their dentures are not in their napkin or on their tray, because those will be really expensive to replace. And then in regards to hair care, some clients get their hair washed, and then some gets their hair styled at the salon. So make sure to communicate with the resident before actually rinsing their hair. When we're doing nail care and foot care, we want to avoid cutting the skin. Usually the clipping of the toenails is completed by the nurse. Report any blisters, skin tear, or ingrown toenails to the nurse. Ingrown toenails are when the nails curl down into the skin. When washing the feet, dry the entire foot, including in between the toes. And then for shaving, make sure that the shaver is working properly. Wet the face and area, hold the skin tight, and then run the shaver over the area, moving in an upwards direction. When bathing, observe and report any skin tear, bruising, skin redness, open wounds, or refusal to the nurse. You want to check the temperature of the water before actually putting it on the client and ask them to verify that the water is a good temperature for them. What they feel and what you feel may be different, especially when you have gloves on. The water might feel warm for you, but it's actually really hot for the resident. Wash the face first and work your way down the body, washing the perineal area last, clean to dirty. When providing perineal care, wipe from front to back and use a clean area with each stroke. For males, pull the foreskin back and return it to its natural position. Report any rash, redness, skin breakdown, new incontinence, odor, dark or bloody urine, diarrhea, or bloody stools to the nurse. And then provide a back rub. Back rubs are always great. It increases circulation in the body. And then again, report any redness, skin irritation, rash, or skin tear to the nurse. When providing bathroom assistance, we want to provide privacy. If the client is confused, we would want to stay within arm's reach to prevent any falls. Sometimes you might use bedpans and urinals. That usually happens more in the hospital setting. And then again, report any skin integrity issues, incontinence, that's new, any odor to the urine, any bloody urine or bloody stools, diarrhea, or constipation. When providing eyeglass care, we want to clean the lens using water or eyeglass cleaning solution and dry it with a soft cloth. Those with vision impairment, make sure we're providing adequate lighting. You may also describe the surroundings, give them step-by-step instructions, and allow them to hold onto your arms while they're walking. In regards to hearing aid care, we sometimes need to help them replace their batteries or help them wear their hearing aids. Red is usually for the right side of the ear and blue is for the left. Never use alcohol wipes to clean the hearing aids. And then make sure that we're removing the hearing aids prior to bathing or showering. And be very careful with the hearing aids. A lot of times, the residents like to wrap the hearing aids in tissue or Kleenex, um, and then those could be easily thrown away. And hearing aids are very expensive, so make sure that we are caring for them and looking out for them. Again, tips for people with hearing loss: approach them from the front, face the person when you're talking, reduce any background noise, and then pay attention to nonverbal communication. Report to the nurse if there's any eyeglass or hearing aid repair that's needed, any redness in the ear, wax buildup, dry or watery eyes. Alright, fall preventions. This is very important. We want to do everything that we can to prevent any falls and injuries. So a fall is a loss of upright position that results in landing on the floor, ground, or on an object of furniture. Another definition is a sudden, unintentional change in position causing an individual to land at a lower level on an object, the floor, or the ground, other than as a consequence of a sudden onset of paralysis, seizure, or overwhelming external force. And so all the following are reportable falls. If a client lost their balance and was lowered by to the ground by the staff, or if the client fell to the floor, but even though there was no injuries, that's still a reportable fall. If the client was found on the floor, even if you didn't witness the fall, that's still a reportable fall. And then if the client rolled off their mattress that was on the floor, and even if the fall has occurred in the past 30 days, and or if they fell in the past 31 to 180 days, and that's a reportable fall. Falls is a leading cause of injury in adults 65 years and older, and a leading predictor of falls is muscle weakness. With residents with increase in activity, they're more likely to fall as well. And then men are more likely to die from a fall, and 20 to 30% of the people who have a fall suffer from moderate to severe injury, including lacerations, hip fractures, and head trauma. So some things that we can do to prevent falls is to modify the environment. Make sure that the environment is free of clutter, no loose cords or wirings on the floor. Make sure that there's railings and grab bars in the showers. Provide adequate lighting. Ensure that there's no wet floors, or if there is, make sure you put up a wet floor sign. Make sure that the equipments are working properly, and then have residents have their annual ear and eye exams. We would also want to assess their muscle strength, gait, and balance. And then we also review medications as well. Maybe they are put on a new medication that increases their risk of having a fall. We would want to review those meds. Make sure that the residents are using assistive devices, personal items are within reach, and always make sure that they're wearing proper footwear, including shoes or socks with grippers. So these are things that we can do to prevent falls. And then there are also factors that we can't really change to prevent falls, such as uneven pavements, doors that don't open properly in public areas, low toilet seats in public restrooms, age, sex, if they have any chronic diseases or illness. Residents with memory loss are at increased risk of fall, and that's something that we can't really change, but we can be more attentive to them. And then residents with stroke or TIA history, they might have like one side that's weaker, and residents with a history of syncope and fainting. So what happens if a resident falls? We want to first assess for any signs of injuries, any abrasions, bruising, lacerations, fracture or head injury as a result of the fall, do not remove the client until you're instructed to do so. If there's a obvious injury that occurred with the fall, like a fracture or head injury, you want to call 911. Make sure that the client is comfortable and ensure that help is on the way. If there's no obvious injury or minor injury only, you can contact the nurse or supervisor, and then you would want to obtain a set of vitals, and then the nurse will notify the physician and family member about the fall. You will then want to document and fill out an incident report, and with these incident reports we want to assess the why of it. Why did the fall happen, and then we would want to come up with interventions to make sure that the fall doesn't happen again. And then all team members are usually notified of the fall. Okay, and then the next few slides will be about emergency preparedness and client issues. If you're prepared for an emergency situation, you'll feel less frantic and feel more in control of the situation. If resident becomes angry or have some sort of aggression, there's usually a cause. Maybe they're anxious about something, angry, or it could be an underlying medical condition. The number one priority is to keep everybody within that environment safe. If the aggression is towards you, you would want to step away and give space and allow time for the client to cool down. If there's another staff around, ask that staff member to attempt intervening with the client. If the aggression continues, call 911. Remember, safety is number one. If the aggression is towards another resident, you would want to move the victim and cool down the client that's being aggressive. Allow the client to cool down, and if you're unable to remove the victim or cool down the aggressive clients, then you would want to call 911 and notify the supervisor. And then once everything calmed down, we want to figure out why the aggression happened and look for opportunities to minimize future incidents from happening. So what do we do if a client is missing? The first thing you want to do is call 911 and then begin the search. When you call 911, make sure that you have a description of the client, what they're wearing, about how tall they are, their age, and if there's a photo, get that photo ready for when the police comes. Explain any limitations of the resident or any other pertinent information. And then you may also want to suggest that for like clients with dementia, they may respond better to a familiar face if they are found. So you may suggest going with the police when they find that resident, if there's another staff at the house, to keep the other residents safe. And then what happens if somebody's heart stopped beating? You really need to know the code status of the client. You don't want to be performing CPR in someone whose code status is do not resuscitate, do not intubate. However, if the patient passed away, we want to notify the supervisor immediately and then wait for directions. Usually if the patient is a hospice patient, we'll notify the hospice nurse, and then they will take care of the next steps. If they're not on hospice and they passed away, we want to call 911, and then the police will do the investigation, and a medical examiner will come to the scene to do their examination. We want to report the time of the death and to notify the family and physician as well. So in a diabetic emergency, the blood sugar may be too low, which is a blood glucose of 70 or less. And some signs and symptoms of low blood sugar may be shakiness, sweating, dizziness, increased hunger, irritability, combative. Some residents become confused, or they may have a decreased level of consciousness. And so what do you want to do when the blood sugar is too low? Give some blood glucose tablets if they have any. If they're alert and can drink, give them a glass of juice, or hard candy and crackers. Um, then you'll want to recheck the blood sugar after they eat something. If it's still low and the client is having symptoms or continued behavior changes, call 911 because they need medical attention. And then a high blood sugar is usually when the blood glucose is greater than 350. Some signs and symptoms may be increased thirst, frequent urination, increased hunger, blurred vision, again, confusion and unconsciousness. When people have high blood sugar, you want to increase their activity or lower their food intake. Can help lower the blood sugar. Make sure that they are drinking water. That can help lower their blood sugar as well. Some residents who are diabetic are on insulin, and insulin can help lower their blood sugar. If it's still uncontrolled after exercising and water intake, you want to call 911. A seizure is an episode of abnormal electrical activity in the brain. Some symptoms may be a brief blackout, drooling, eye movements that are not normal, a loss of bladder or bowel control, the body is shaking, or any uncontrollable muscle spasms. These symptoms may last from a few seconds to minutes or continue up to 15 minutes. So when a patient is having a seizure, you want to time how long the seizure is lasting. The main goal is to protect the client and others from injury. Try to prevent any falls from happening due to the seizure. Lay the client down, laying on the side if possible to prevent any aspiration. Cushion the person's head. And then we want to make sure that you clear the area of any furniture and especially any sharp objects that may be on the ground. Do not stick anything in the resident's mouth. Again, note how long the seizure lasts, and then for all seizures, call 911, and the medical personnel will determine if they need to go to the hospital or not. A stroke occurs when blood flow to the brain either stops or is decreased. Some signs and symptoms of a stroke is a sudden numbness or weakness of the face, arm, or leg, any sudden confusion, difficulty getting words out or having some slurred speech that's new, any sudden difficulty walking or having balance issues, sudden vision changes or difficulty seeing in one or both eyes. Another symptom could be like a severe headache with no known cause. If any of these symptoms occur, call 911 immediately. It's a medical emergency. One way to remember these signs and symptoms is to remember be fast. So balance, eyes, face, a droop in the face, arms, weakness in the arms, speech, and time. So when a person is choking, they may be using the universal sign of choking, which is bringing their arms up to your neck. There may be an inability to talk, some difficulty or noisy breathing, decreased level of consciousness. The lips or skin may also turn blue. Your quick action can be life-saving, so you want to call 911 immediately and then perform the Heimlich maneuver for any choking victim who are conscious. And how to do this, you would wrap your arm around the waist from behind and then make a fist with one hand slightly above the navel below the rib cage, and then you'll grasp the fist with the other hand and then press hard into the abdomen with a quick upward thrust as if you're trying to lift the client. You would want to perform this 5 times, and hopefully by then help is on its way. So when do you want to call 911? You want to call 911 if there's any difficulty breathing or if somebody stopped breathing, any uncontrolled bleeding, new chest, neck, arm, or jaw pain, any fractures from a fall, if there's some poisoning in a diabetic emergency, if a client is missing, any severe burns, a sudden weakness in one leg or arm, or if they're unable to move a limb that's